applications, it's really nice because they are so gorgeous when you're done.
And they don't take as much work, I don't think, for.
Well, in one aspect, they don't take as much work, but there's a whole lot of work before you ever put the patient in the chair to start. I charge more for veneers than I do for crowns in the back because, let's say we've planned it and you need a crown, a cap on one of your back teeth. You show up, I just do it, and we make it basically like it used to be. For veneer, that has to be planned. Photographically, I'll take models of your teeth, the plaster models, and I will design that between me and the lab in wax because we can change it easily to make it look like we want to look like it. So once your butt hits the chair, it may be fairly rapid, but there may have been 3, 4, 6 hours of planning when you're not there. I'll go in the office on Friday and Saturday when it's dead quiet and these ladies aren't bothering me to do these kind of planning things. So a veneer case, once you're in the chair, may be fairly rapid, but there's a whole lot of planning what goes into one beforehand. You can't just prep the teeth, take the mold, the impressions, send it to the lab and say, make pretty. You have to plan it. They have to know, make pretty how long, what color, how wide, all kinds of things that go into those aesthetic things that you don't need necessarily. For a back molar tooth, as long as it's pretty close to the shade of the other tooth and looks like a tooth and not like a corn nut, you're okay. So, well, that's the joke. When we're in, there's a story here. When we're in dental school, one of the first things you do is you make teeth in wax. And so my lab partner was a magician. He spent 8 hours on his wax up, and it was a lower first molar, and I'm not going to get into all the anatomy, but there's overall anatomy, then there's the secondary anatomy, and there's what's called tertiary anatomy. That's grooves in the grooves. And Mark was French. He'd come to the States when he was 16, and he just hands like a magician, and always showed me up. But anyway, his tooth just looked like a tooth that happened to be green because it's green wax. I get mine back scored, looks like corn nut. So I still got I think a B+ on it. Mark he was the best in the class for that particular project. His looked like a green tooth. My comment looks like corn nut. And then I looked at it, and yeah, you're kind of right, it does look like a corn nut. It was green, a green corn nut, because the wax was green. So how did they get off into the weeds there? See, he took me off into the weeds here. So front teeth, veneers, or anything other than a single crown, there's a lot more thinking has to go into doing that because it matters as far as aesthetics, of course, but things you don't think about, but phonetics and speech. When I'm doing dentures, one of the most important appointments is what we call the try-in. We've made the molds, we've picked the teeth that me, the patient, maybe the patient's spouse decides they want. I pick the teeth size based on how big their face is. I mean, you wouldn't put little teeth in a big fat head like mine, but you wouldn't put my teeth in Leslie's on her phone back there. You wouldn't put my teeth in that little bitty face there. It would look like a horse. So we picked the right teeth, the right shade, everything, but just as important is where I put those teeth in the person's face. Up, down, side. So phonetics are based on that, so that's an important part of making a set of dentures, or veneers too, because you make your F's and your S's with your front teeth, and if they're in the wrong place, you hiss. You can't say fine. So one of the things I like to tell people when I'm doing a try-in, the teeth are set in wax on a denture base, and they're going to look like that when we're done if we approve of them. And so my trick is to get them to count from 50 to 70. There's a lot of F's and S's between 50 and 70. And I'll look at them and listen and say, okay, count from 50 to 70. And sometimes I have to say, okay, 50. That's a joke. 51. So 50 to 70, we get all the F's between when we get to 60 and then 60 to 70, I get all the S sounds. And I'm listening for hisses and pops and clicks. And if I hear those things, then the teeth are, I need to reposition them somehow. And then they still need to look good. And I hand them a big mirror and say, do you like that? And then remember they're in wax, and I say, okay, they look too perfect. Let me take two of them and twist them a little bit and make them look real. And that's kind of fun to do. So I take a denture that looks like a set of piano keys and you twist two of them, and all of a sudden it looks natural. Right? And I'm not